everyone, I'm Melissa Kerner from FriendYourBody.com, and I'm here with Dr. Jean Nordin-Evans of the Groton Wellness Center in Groton, Massachusetts. And she is going to talk to us today about some of the potential hazards with traditional forms of dentistry, and she's going to tell us a little bit about how we can avoid some of those hazards, and she'll offer some tips as to how we can maintain healthy teeth. Dr. Jean is actually a holistic or biological dentist. I wanted to start by talking a little bit about the difference between holistic or biological dentistry and just, regular dentistry. What are some of the major differences?
So what we call ourselves health-focused dentistry, but it's very, very similar to holistic dentistry or biological dentistry, integrated dentistry. Those terms can be used interchangeably. So holistic dentistry just means first and foremost that we try and avoid toxins, toxins and toxin exposure as much as possible, whether that's in filling material, fluoride, root canals, metals, plastics these days, and just continuing to look for the safest products that are available to use for our patients. So it's toxicity around materials, it's not using mercury fillings, proactively taking them out for a lot of patients, not recommending or performing root canals, proactively taking them out a lot of times, and also the metals and avoiding them as much as possible, whether that's in crowns, bridges, and these days implants.
Can you tell us a little bit about how someone's dental health actually impacts their overall health? I don't think a lot of people think about that. They think just about, what's going on in here, but that can affect a lot of who you are. Can you kind of talk a little bit about that, how that can actually manifest in other ways?
What's happening in your mouth can affect the rest of your body, physically, energetically, structurally, how you're able to chew or not chew. There's so many ways that's what is happening in your mouth reflects and is connected to the rest of your body. First and foremost, mercury fillings are a neurotoxin. So, our body is run by our neurological system. So those affect the body that way. Every root canal is not only a toxic stress from the bacteria that infect that root canal, but they're also an energetic stress. So according to acupuncture meridians, different teeth lie on different meridians. So there are specific teeth that are related to the breast. So for instance, if a woman has a history of breast cancer, there are particular teeth she wants to make sure that have not been root canaled, because it could affect her healing and her prognosis long term. There's the electrical activity that happens between different metals. If you have mercury in your teeth and gold, or mercury in your teeth in a dental implant, that can affect the functioning of your brain, because there's actually electricity and electrical activity that happens, and it can just interfere with the electrical activity that's happening in our brain and with the cells as they communicate.
Let's talk more about the mercury fillings, because that's always been kind of a very interesting topic to me, because there's different schools of thought out there. A lot of the research that I've done supports that it's really not healthy for your body, and yet you have some dentists saying it's perfectly safe.
Right.
So first of all, can you explain what a mercury amalgam filling is, and then talk a little bit more about some of the risks involved in not having them removed?
Sure. So a mercury filling is not just mercury, it's an amalgam. And the definition of an amalgam is a group of metals, or a group of things, in this case a group of metals. So there's silver, tin, copper, and zinc. Those are the hard metals, very, very ground fine metals. But those metals need to be held together by something. And mercury is a liquid metal at room temperature. It's this magic substance that we have on this planet. And it really is magic until you realize truly how toxic it is.
Right.
And so there has to be approximately 50% mercury, 49%, 52%, depending on the particular manufacturer. So it's not a silver filling, it's actually a mercury filling because the majority of the material is going to be mercury. So dentists have been using mercury fillings for well over 150 years. The reason that they like them is because it's cheap material to buy and it's very easy to use. You know, you could put a mercury filling in a tooth that's wet with saliva and bloody from the gum around it, and it's still going to set up and be relatively successful. The problem with mercury is that because it's a metal, one of the problems is that it expands and contracts when you eat hot foods and cold foods. So that's always going to create some microfractures in the tooth. So many patients that I treat will, you know, they'll be going on fine with a mercury filling, and then they bite a popcorn kernel or a hard piece of bread, whatever, and a whole portion of the tooth fractures off. It's not the mercury that fractures, but it's the portion of the tooth, because the mercury has caused cracks within it and just totally weakens it. So then they go from a tooth that has a filling in it to needing a crown, a more extensive treatment.
Okay.
And again, mercury is a neurotoxin. Mercury is the most toxic substance we have on the planet that's not radioactive. We can't have it in thermometers anymore. They close down lakes that have fish that they found with mercury in them. You know, there's advisories around eating tuna if you're pregnant. But yet, for the most part in this country, placing mercury in your mouth to suck on 24/7 is totally unregulated. Whether you're a child, whether you're a pregnant woman, you know, whether you're a demented adult, you know. It's pretty ridiculous.
It's pretty crazy.
It's totally crazy. You know, I say like 100 times a month, I feel like I'm in the Twilight Zone, just talking about the dangers of mercury, you know.
Can you, and there's a lot, can you just kind of highlight some of the major health ramifications or problems that can manifest? I mean, I know there's like a laundry list of things, but what are some of the major things that someone can expect if they have exposure to mercury, especially long term?
You know, the list is so long, and you know, in my over 15 years of practice, I can't, you know, I've probably taken out well over 1 million fillings, and it's been very rewarding because there's so many different symptoms that patients report changing.
Can you tell,
you know,
like, if you have a story? You can share like when someone had their fillings removed?
A simple one can just be a patient that would say, you know, I used to get sick every year, 2 or 3 times a year, and since I got my mercury fillings out, I feel so much better. And you know, I can't tell you when the last time it was that I got sick. So in that case, it's just boosting the overall immune system so that the patient feels better in general. I've had patients that have recovered from multiple chemical sensitivities. Eczema is a really common one because the body, you know, our biggest detox organ is the skin. Yep. So the body's trying to get rid of it. You know, eczema, other skin conditions, sleep and sleep disorders, because what's happening with the electrical activity that's going on in the mouth, again, is interfering with the functioning of the brain, whether that's the pituitary and our sleep hormones or just the cellular connections that are going on there. But again, it's a neurological toxin, so, you know, sometimes it's tremors that people have that can be reversed, or MS, or lupus, or, you know, it goes on and on.
Some dentists argue that, you know, once it's solidified, you know, it doesn't continue to release, and yet I've seen videos that show the opposite of that. So just to kind of explain to people,
that
is it
used
constantly...
to be, before the advent of the internet and before a video was actually made, it's smokingtooth.com.
Yeah.
It's an easy place to go to. before that video was actually made, it was easy, right? It was easy for dentists to say, no, no, don't worry, it's totally encapsulated. I have them in my mouth. I put them in my kid's.
All right, let's do it. Tell us a little about root canals. What's the problem with that?
So the problem with a root canal, or actually the good thing about a root canal theoretically, is that you're able to keep a tooth that has had a nerve injury. Oftentimes bacteria from a deep cavity or sometimes even trauma can get into the pulp, the nerve of the tooth, and flourish. So that tooth ends up dying. Abscess is the common term that's used. So a root canal is performed to remove the majority of that nerve, which actually only ends up being about 60% of the nerve is what they can access, and then filling that nerve canal with a rubber-based material. And on the surface, dentists think that that's a good treatment because it allows the patient to actually keep that tooth. What we're learning more and more about, a lot due to Hal Huggins and his investigation of this, is that the bacteria that end up flourishing inside the tooth once the root canal is done, because there's only 60% of the nerve gone, so there's 40% of the nerve that remains. Bacteria enters into the tooth through the side and then has food to live on, which is the decaying nerve, and then they set up shop and they flourish, they multiply rapidly. And what we're finding with Hal Huggins' work is that the bacteria that are down there are the most toxic anaerobic bacteria that have ever been found in the human body. Wow. And so what happens when you have a root canal is your body produces that bacteria, or that bacteria can set up shop, and then you chew on that tooth, and that bacteria and the byproducts, which are actually very toxic too. Bacterial byproducts are just bacteria poop. Not to mince words, gets spread.
They produce waste just like human beings.
Just like everybody else that's alive. You know, goes into the bloodstream and gets carried throughout the body and can affect you in many numerous ways. Negative ways. The other problem with every root canal, like I spoke of before, is that every root canal is connected to some other part of the rest of the body, actually many parts of the rest of the body, via acupuncture meridians. So if you do have a root canal, it's very important to go online and pull up the chart, you know, tooth meridian chart, you can easily find it, and understand what parts of the body are connected to that tooth.
Specific tooth, okay.
You know, sometimes patients will, like one dramatic case is, I had a patient come in with a root canal, I believe it was a lower bicuspid, and she had recently been diagnosed with a pituitary tumor, and lo and behold, that bicuspid was connected to the pituitary gland. Wow. So we ended up taking it out, and her pituitary tumor got dramatically better.
Do you find that when it comes to root canals, I mean, oftentimes are they unnecessary for the most part,
yes.
or are there times when someone really needs to have them done?
You know, I can't tell you how many people I've saved from needing a root canal in my career.
Okay, so they're overdone.
They're
would you say?
overdone.
Okay.
Over-prescribed. I actually just had one yesterday. A woman came in that had some decay in the tooth, and her dentist was just writing it off, saying, no, the decay is too deep, go get a root canal. She had no symptoms, she had no pain, she had no sensitivity. We took out the old filling, removed the decay, and I presume the tooth is going to live happily ever after.
Excellent. I like stories like that.
Yeah.
That's great. That's great.
It happens all the time. It's, you know, unfortunately, it's a very profitable service in the world of dentistry.
So it's a business. Yeah.
It's, you know, like all of healthcare these days, it is a business. So you have to be your own. You have to be your own best advocate. And if you're recommended to get a root canal, please get, you know, 2 or 3 opinions to verify that It's really the only way. And then let me just say one other thing.
Sure.
So the alternative to having a root canal would be just to proactively take the tooth out.
Okay.
And in this day and age, that's being done more and more in the world of holistic dentistry and elsewhere, because even within conventional dentistry, we know that most root canals will only survive 5–10 years before they re-abscess.
Okay.
So the thought is to save the thousands of dollars that you would put into doing a root canal and a crown and a buildup into just taking the tooth out and putting in a dental implant. We started doing dental implants about 3 years ago because zirconia implants, zirconia is actually the first non-metal implant that's available in the United States. So zirconia implants became available, and they've been very, very successful in our hands, and will slowly, as the years go by, replace titanium in other dental offices. But unfortunately, I think they'll be slow to change.
Yeah.
So instead of getting root canals, just think about taking it out, get an implant, and live happily ever after.
Good.
Or not replace it. I mean, you don't necessarily have to replace the tooth.
Right.
You can get a bridge. You can wear a partial. There's always
So there's
options.
different options to choose from.
It's not the end of the world to lose a tooth.
And what about fluoride use? Because that's another kind of controversial topic.
Right.
What is your position about using fluoride, and what are the potential hazards of using it?
My position on fluoride is that for sure, make sure that it's not in your water.
Okay.
That you're drinking. If it is in your water, the only way to get out fluoride is to use a reverse osmosis system at your countertop. But the problem with reverse osmosis is that it not only takes out the fluoride, it takes out all of the other minerals that are in the water.
Okay.
So there are machines now that will actually add minerals back in once the water has been thoroughly cleaned. So you need to get a machine like that, because otherwise the pH will end up way too acidic, and it'll do other bad things to your teeth and the rest of your body. So I definitely don't like fluoride in the water. I don't use any fluoride topically myself, nor do I use fluoride for my children. I feel like xylitol is a very safe, natural alternative to fluoride. Xylitol is a natural sweetener that inhibits the bacteria from being able to attach to the tooth. So it mechanically inhibits bacteria and a problem. Just the science behind fluoride being absorbed into the tooth and actually remineralizing that, it's not all that great. And I truly feel that if you eat a healthy diet, drink your raw milk, eat your grass-fed meat, that you can avoid it. And again, it's just another toxin that we have on our plate.
Me to it, because I was going to kind of wrap up by having you share your top 3 tips for maintaining healthy teeth. So diet is huge.
So eat a very healthy diet. I'm a big fan of the Weston Price Association, the paleo diet, grass-fed dairy, raw dairy. It would be wonderful if we could get raw dairy legal in the state of Massachusetts.
We can get some in New Hampshire.
Yes.
I'm able to get some at my natural local food store, so that's pretty good.
Yeah, New Hampshire is much better. I'm a huge fan of coconut oil, using coconut oil swishing first thing in the morning when you wake up, preferably. Performing good oral hygiene, which would be coconut swishing, flossing, brushing. But the other thing that I think is really, really important is to love yourself and to love your teeth. I believe that if we take care of something, if we cherish something, if we feel that, no matter how many cavities you've had as a child, your teeth are valuable, and you really want to keep them, then energetically your body will serve you and you will keep them.
Right.
You know, what I don't like the most is when I get a new patient that just says, "Oh, I have horrible teeth. I know I have horrible teeth. Just tell me I have horrible teeth." And I say, "No, you definitely do not have horrible teeth. You are a beautiful person, and your teeth are beautiful, so hang on to them."